Welcome everyone. Thank you so much for joining us today, and welcome to this webinar event in collaboration with Metagenics and Fullscript. I am Amy Regan from Fullscript, and I am so glad that you've joined us today. Anybody who has any questions about the webinar as we go along or wants to view the recording after, that will be sent via email. And any of your Q&A questions, please pop them into the Q&A box as we go along. And it is my pleasure to introduce to you today Malisa Carullo, who is the manager of medical information at Metagenics. She completed her doctorate in naturopathic medicine at National University of Health Sciences in Chicago, Illinois. She completed her MSc in biology at the University of Ottawa with an emphasis on genetics and molecular evolution. Malisa puts much focus on biological medicine and its treatment of chronic diseases, as well as healthy age management. Her practice interests include endocrinology, chronic infections, and blending naturopathic medicine with sports medicine. She is currently working, like I said, as a manager at medical information at Metagenics. Malisa, thanks so much for joining us today, and welcome.
Thanks, Amy. Thanks. It's good to be back, and welcome to everyone. Thanks for joining our webinar today. Today we're talking about restoring balance in the gut. I think it's a common topic. It's buzz out in social media. So hopefully you walk away today with some good takeaways that you could use in practice. In the presentation, the objectives really are going to aim to uncover the impact of gut health and provide insights into how supporting the gut can lead to better health outcomes. So we're going to start by briefly touching on the importance of the gut ecosystem and the impact on health, and then move towards, a bigger, broader picture and touch on various axes that have a connection to the gut. So I'm going to highlight a few modifiable factors that will disrupt the gut microbiome. So we'll talk about those. And then lastly, we're just going to touch on a few ingredients that support restoring the gut back to homeostasis. So gut health really encompasses this balance and function of the entire digestive system. So that's going to include the microbiome, the integrity of the intestinal barrier, nutrient digestion, and absorption. And this gut communication with other body systems is part of the GI system as well. This could be immune system, nervous system. And there's numerous benefits of maintaining this GI system, especially the gut flora. So these good microbes, they're going to ferment dietary fiber. They're going to produce short-chain fatty acids. A lot of us know about short-chain fatty acids. These are essential for nervous system support and overall health. Each species is going to contribute uniquely to maybe vitamin synthesis and producing antibacterial compounds to prevent inflammation, leaky gut, and dysbiosis. And then also gut flora helps to strengthen the barrier, the intestinal barrier. It can modulate immune responses and directly influence immune cells. So there's many key factors that will shape the health of the gut ecosystem, and clinically understanding how these various factors are essential for developing effective treatment plans is really important. So, for example, patients with a history of C-section birth, formula feeding, or maybe even just a lot of antibiotic use at a young age, they could be at greater risk for gut imbalances, and that could lead to immune dysfunction and the possibility of digestive issues later in life. Lifestyle factors like chronic stress, poor sleep, and physical inactivity, that can all exacerbate gut-related conditions as well. And, this could suggest also that stress management or improvement in sleep hygiene, this could be part of the comprehensive plan for patients. So clinicians can really, use all of these ideas to address multiple factors associated with underlying causes for whatever the disease state or condition is for that patient. So gut health and its connection to the brain, this has really revolutionized medicine's understanding of links between digestion, mood, and neurological health. but also spearheaded a lot more research, and that's emerging constantly, and that's between the gut and various other body systems. So that could be endocrine, urogenital, immune. There's quite a few that we're going to touch on. So the GI supersystem, this refers to this complex and interconnected network of organs. It's going to comprise of microbes, immune cells, signaling pathways, and they're all going to work together to regulate the GI health and overall body function for an individual. So it's not going to just include that GI tract, it's going to stem from there. Stomach, intestines, gut microbiome, immune system, nervous system, hormonal signals, and the list goes on. This is a really nice figure. There's a lot of great diagrams in this presentation. I think you all are going to be pleased with that. Good printouts to use with patients because visually learning is a lot easier for most individuals. But this figure illustrates the concept of the gut as that central hub. It's going to be that central hub that influences multiple body systems. They're interconnected through various axes. It could be gut brain, gut heart, gut liver, and so on and so forth. So gut microbial eubiosis, this is this balance that promotes positive outcomes across these axes. And it's really going to support mental, metabolic, immune, and even reproductive health. It's this holistic approach, right? We want to hit every axis that is going to be contributing to the disease state or condition. So disruptions in this gut balance is going to lead to multiple dysfunctions in systems. And we're going to look at a few of these in particular. So we'll start with the gut immune axis. So the gut immune axis, this is definitely complex. This illustration definitely does simplify interactions a little bit. If we start on the left-hand side of the slide, we can see that gut microbes produce small molecule metabolites, extracellular vesicles, neurotransmitters, and hormones. And these can all enter circulation. They could travel to distant organs where they're going to impact immune cell development and function. The gut microbiota also locally educates immune cells in the GI mucosa. So those can then migrate to systemic sites, and that could contribute to a lot of host defense mechanisms. And then lastly, what we see on the right-hand part of the slide is these long-distance communications by the gut that are mediating neuronal communication. So, moving up to the brain. These microbiota-derived compounds, they're sensed by the enteric nervous system, and they are going to move via signaling of afferent and efferent vagus nerve communication. And I guess the central nervous system would be involved in that as well. Here we're looking at bidirectional communication between the gut microbiome and the brain. It's highlighting very specific several key pathways that are included in the circulatory system here. You can see the vagus nerve, enteric neurons, and through the microbiome or the metabolites of the microbiome, like neurotransmitters and hormones, this is going to influence brain function. So the gut epithelium through these enteroendocrine cells, the gut cells, maybe cells like dendritic cells, these are all going to facilitate transmission of signals from the gut directly to the brain. They will help regulate the gut-brain barrier and the integrity of that gut-brain barrier and overall just brain health. So this complex interaction, I think, is really, underscores how gut health is directly tied to neuronal function, but also conditions associated with neurological health. So the connections between the gut and the urogenital axis. I think these are less likely known than those of the gut brain. This is a really nice figure. It's going to illustrate pathogenesis of, you can see bacterial vaginosis here, vulvovaginal candidiasis. There's highlighting the role of probiotics in maintaining a healthy vaginal environment and then ultimately being able to prevent infection. So you can note the differences here between a healthy vaginal environment that would be characterized by a lower pH, and then also note the lactobacillus dominance that we see in the slide. So an unhealthy state is going to have an increased pH in the area, inflammation, and pathogenic overgrowth. I think that I want to highlight for sure on this slide the fact that probiotics such as lactobacillus and bifidobacterium, they could be administered orally to restore balance. And I think this makes sense from a few of the previous slides as well, noting that we have production of metabolites from probiotics or any good bugs in the gut. So just like short-chain fatty acids are produced and utilized to maintain intestinal cell integrity, there's going to be specific metabolites used and synthesized in the gut that would make their way to the vaginal microbiome. These could be things like lactic acid or bacteriocins as well. So depending on their origin and their synthesis, microbial metabolites can be broadly divided into 3 groups. It could be metabolites that are produced directly by gut bacteria that are resident in the gut, in combination with dietary components like short-chain fatty acids. There could be metabolites produced by the host, and then those are modified by gut bacteria. So we can think of bile acids here. And then metabolites that are synthesized de novo by gut bacteria. So that would be, an example there would be vitamin K2. So personally, I think that this concept, the role of the gut microbiota in producing this variety of beneficial metabolites for use throughout the body in different organ systems is much undervalued. I don't know if it's because we're not familiar with it as clinicians. We don't discuss it enough. Maybe we discuss the same ones over and over again, like short-chain fatty acids and butyrate, but I don't think that we realize sometimes that at some point good bacteria are going to be involved in the physiology of all of these signaling molecules. And I think that's really important to carry through the rest of the presentation as well. So moving on to factors that will disrupt the microbiome. So most of these are, they're not new. This isn't new to you. This is probably just review. These key contributing factors that disrupt the GI super system are those that, are processed foods, low fiber diets, medications. The take-home message here is really that each of these factors is going to damage the balance of the beneficial microbes. It's going to lead to dysbiosis, that imbalance, and that's going to be linked to a variety of health issues, over time or systemically throughout the body. Clinically, this is significant because obviously addressing these disruptive factors through dietary changes, perhaps reducing medication use, increasing physical activity, these can all help restore the gut balance and really just improve patient outcomes in conditions that might range beyond the GI tract. Okay, so at baseline in humans, this is an interesting figure, and this is what it's showing. At the top, you see that in baseline in humans, this eubiosis or this balance of the gut microbiota, this is associated with physiological immune tone. And then we have various triggers coming in alongside genetic predisposition, and then mix in our modern environmental changes. This can all lead to imbalance of the gut microbiota. Finally, at the very bottom there, we see that exposure to stress signals like above the system's like robustness, this can lead to a sustained alteration of inflammation and just change in the balance of the microbiota. So again, clinically, this is going to be significant because, depending on how long the microbiome has been disrupted for, and then you take into account the number of triggers that are contributing to the dysregulation, time to restoration for a patient is going to vary. So it's just a small plug here to remind yourself as a clinician and then also as patients that protocols in some instances do take time before we see resolution. Specifically looking at dietary components here and how they influence health through both microbiota dependent and independent pathways. We can see that diets low in fiber and high in calorie-rich foods like saturated fats, food additives, refined carbs, they're all going to have adverse effects on the gut health, right? Our gut, our body, they do not like these foods. These dietary factors are going to directly impact and alter the gut microbiota, and that's going to lead to reduced amount of diversity or beneficial metabolites that will be or could be produced in the gut. Over time, again, this alteration is going to weaken the epithelial layer, that barrier function, reduce immune tolerance, and increase inflammation systemically. So we're seeing like the same pattern come up over and over again. Hopefully you're not sick of hearing it, because I think repetition makes it stick. Because this is really important, as we're going to see as throughout the slides, that really being able to address these basics and going back to basics is really the foundation of a lot of integrative health protocols. So this slide might be a good one, I think, maybe to print out if, it might come in handy when you're discussing nutrition or like coaching patients around dietary changes. It really outlines the effects of various food additives, artificial sweeteners, or, these substances that can alter the gut microbiome. These substances are going to often lead to decreased bacterial diversity again and increased gut permeability. So what does that tell us? That with time, we're going to get reduced mucus production and then again, damage to the barrier. These changes are going to contribute to inflammation systemically, once again, activation of pro-inflammatory pathways, and possibly the production of like harmful substances in the body. Again, I think this figure just underscores how commonly consumed food additives are with our patients, and they have detrimental effects on the gut. So being able to talk to patients about this is very helpful. Okay, so I won't spend a lot of time here, but I think that I can sum up, the theme of the slide by saying that, okay, I just wanted to see, I didn't have technical difficulties. The theme of the slide here is that there's really a time and place for antibiotics, right? Or any medications to be utilized. We know that the use of medications, over time, the longer we use them, they're going to come with some unfavorable changes to microbial diversity, but also damage the mucus layer and increase the risk for pathogens to colonize. So thinking beyond the gut, these disruptions can cause dysregulated immune responses and impact the GI super system as well. So I'm just advocating in this slide in particular that when antibiotics are prescribed, maybe give a probiotic alongside the antibiotic, or when magnesium depleting meds are being utilized, perhaps we should be suggesting magnesium glycinate or another form of magnesium, in combination with the medication. So in most published cases, we do see that recommending both therapies together always yields better outcomes for patients. So it really is a win-win. This slide is specifically illustrating very complex interactions between the gut-brain axis, but it definitely does highlight how stress and the gut microbiome influence each other as well. I want to emphasize here that chronic stress is a really powerful example of how interconnected our physiological systems are, and how a prolonged stress response is going to produce these like downstream cascading effects that are going to reach far beyond mental health domain or that gut-brain axis. So an example would be chronic stress is going to increase heart rate, blood pressure due to that constant activation of the sympathetic system, that sympathetic overdrive. This can lead to hypertension, maybe risk of heart disease, possibly, heart attack or stroke. Another good one's the nervous system, right? So if we constantly have this sustained chronic stress response and sustained release of stress hormones like cortisol, it can really damage neurons in the brain and impair function of memory and learning. And I give this example because I think most of us on this webinar can relate, right? Some of us have experienced this firsthand. If there's a difficult or stressful period of time in our life, it's often hard for us to look back on that period and remember what we did. Did we turn the knobs on the stove off? Just little things like that. I think that we can notice that stress will impact that memory that we have. There's definitely other examples, but I think that the common denominator here and that every scenario is that changes are going to occur first in the gut, and then imbalance of the gut microbiome and integrity are going to take place. And over time, we're going to see that triggering of systemic inflammation, ultimately disrupting communication pathways throughout the whole body. So here's a beautiful summary slide. And that tagline is the best. One dysbiosis, endless impact. So I hope all of you think of Metagenics when you hashtag that line on social media, because it is profound. It's a profound tagline, and it emphasizes that, basically that central role of gut health in systemic wellness. That's how it could be summed up. Okay, so let's move on to prebiotics, probiotics, and their role in supporting gut health. There is well-documented evidence that diet can have a substantial direct effect on host physiology and health. There is growing evidence that suggests that diet may also have an indirect effect by altering gut microbiota composition or its production of metabolites, and that in turn will impact host physiology. So this was what I was mentioning a couple slides ago, that focus on the production of the metabolites. There's a lot of research that is focusing on, like, what is the gut microbiota doing? What is it synthesizing? What are those metabolites? And I think it's something that's really intriguing, and it's something to watch going forward. And I'll point out a few other key areas on slides where that's evident, and how that might relate to clinical practice. Prebiotics, these are substrates that are selectively utilized and have adequate evidence supporting their health benefit to whoever the host is, the target host. Dietary prebiotics are typically not able to be digested or degraded by human digestive enzymes, hence the need for specific beneficial microbes to do that job, to break them down and digest them. This slide, this is an overview of key characteristics of fiber and prebiotics, and then their role in supporting gut health. You can see that it differentiates between insoluble and soluble fibers. There's a list of examples of fiber-based prebiotics like inulin and fructooligosaccharides, as well as like non-fiber prebiotics like lactulose. So overall, a nice reference slide for you as well. Okay, so as I mentioned, prebiotics, they're going to enter the gut and are selectively utilized. This step increases bacterial growth and functionality of specific bacterial species. And as a result, both of these effects are going to have a health benefit, such as, bulking the stool or normalizing bowel habits, right? And that's because of the increase in microbial diversity and microbial growth overall. Immune regulation can be influenced by an increase in biomass as well, and cell wall components of the bacteria. And then we could also see that metabolic products such as organic acids, they have the potential to lower intestinal pH. They could also have concomitant effects on pathogens or mineral and vitamin absorption as well. So a lot of great things that happen downstream of prebiotics being digested from good bugs. Probiotics, these are live microorganisms, and when we administer them in adequate amounts to patients, or orally ingest them ourselves, we're going to confer health benefit via these specific mechanisms. Some mechanisms might be like widespread among a certain probiotic genus. Others might be just frequently observed among strains. But it may be rare and present to only see a few strains of a given species. So this is why it's important to have kind of a mixture or diversity of genus, species, and strain. Not all probiotics are going to be the same. Not all strains are the same. Mechanistically, they don't work the same way. What they produce metabolite-wise won't be the same. And we don't know everything about these metabolites right now, but what we do know is there's a lot of them working to support our gut health and then also signaling systemically throughout the body. So again, kind of a plug for multi-strain probiotics and also just changing it up once in a while, moving through different strains, changing your formula. This slide is going to highlight really intricate mechanisms through which probiotics really influence gut microbiota. It can do that locally in the gut, but also then again systemically, like I mentioned. So there's 5 steps. I'm not going to read them to you, but I think that, I would just note at a few of the steps the metabolites that are listed there. So again, it's encouraging more thought and discussion around the transient behavior of both the bugs, but also the metabolites following oral ingestion, right? So for instance, it just brings up the question, is vaginal insertion less favorable than oral supplementation because you're bypassing these important or appropriate gut mechanisms? Is it necessary to have this gut interaction so we have these metabolites? I mean, I have my opinions about it, but definitely this is something to consider, right? Especially with patients who might feel more comfortable or want to do a vaginal insertion should they want to support vaginal microbiome. It might be the better way through oral supplementation. Looking at specific probiotic strains in the next clump of slides, Bifidobacterium lactis B420, this has been clinically studied for its effectiveness in supporting metabolic health and also weight management. So some really good clinicals on this probiotic. Research shows that it can help reduce body fat mass, in particular visceral fat, and then also support gut barrier function overall. So it will help regulate appetite by modulating a lot of the satiety hormones in the gut. Lactobacillus acidophilus, NCFM, this is a really well-researched probiotic strain. There's a range of documented health benefits. It's known for its ability to support digestive health. It can also just maintain a balanced gut microbiota. It can promote immune function, and it could or may also reduce symptoms of lactose intolerance. Not always, but it does do a pretty good job at that. Clinical studies have shown its effectiveness in reducing gut inflammation. It can improve intestinal barrier function and support just gut health overall. So I think of this strain when I'm in need of a versatile probiotic because it can play a role in maintaining vaginal health. It can provide relief from occasional digestive discomfort, and then it can also support immune signaling. Bifidolactis BI07. This is recognized for its role in promoting immune and digestive health. It supports the gut microbiome by enhancing microbial balance, improving barrier function once again, and aiding in digestion of dietary fiber. It's been shown to boost immune function as well, particularly by supporting healthy immune responses and increasing antibody production. Additionally, it can help reduce GI discomfort, and oftentimes this would be in one of my formulas if I'm trying to support just gut maintenance or strengthen the body's defenses against pathogens. I might choose something that has BI07. So this bacillus strain is spore forming. So that means that it's basically very naturally resistant. It's going to ensure stability and processing and storage through the acidic environment of the stomach. This strain supports digestive health, improves the gut flora, reduces gas and bloating, aids in breakdown of nutrients. It's the whole real deal. So a lot of spore-based probiotics do a lot of great mechanisms, have a lot of great functions. But I think where they fall short, or that what we have to remember, is that they're not commensal, right? These aren't human strain. They're not necessarily going to take up residence in the gut for very long. So this is another example of a spore-based probiotic. It's going to promote digestive health. It can aid in the breakdown of food, again, enhance nutrient absorption, help regulate inflammatory responses, helps with intestinal barrier integrity. Again, the benefits of these two strains, they're a really good choice or an ideal choice when we're trying to recondition the gut, per se. They're not going to really support the commensal flora, but if we need to strongly recondition or change that environment, this might be something to consider before moving to a human strain probiotic. Okay, the DDS1 strain. This is particularly noted in reducing symptoms of digestive discomfort. This could be bloating, it could be gas, irregular bowel movements. It also aids in enhancing nutrient absorption. So clinical research also suggests there might be the ability for this probiotic to mitigate the impact of the stress response on the immune system. And again, like if we think about a couple slides back with that GI super system, this should be no surprise for quite a few of these bugs, and especially in combination, making them very diverse together. They should be very good at mitigating the impact of stress. BB12, this can help normalize frequency of bowel movements. It can impact various aspects of immune health in both adults and children. And I think that is what makes this a really nice probiotic, is that we do have some nice clinical research supporting its use in children. Okay, the research supporting the use of these two lactobacillus strains in combination is quite profound. For most of you, you might have even seen these strains or heard of this combination before. There's quite a bit of data, a significant amount, that demonstrates these two strains have the ability to increase the effectiveness of various pharmaceutical agents when taken simultaneously. This could be to treat bacterial vaginosis, urinary tract infections, and candidiasis. Some of these same studies, they've also showed a decrease overall in antibiotic resistance when recommending the two together, the pharmaceutical, but also the probiotic in combination. So again, when the standard of care is to give antibiotics, we should be doing that. We're not trying to sway you away from that. The message is, let's just try and incorporate probiotics at the same time. Klepios, this is a really unique probiotic strain. It's newer to my knowledge. It's known for its resilience, its multifunctional health benefits. It's quite effective in promoting gut health by balancing intestinal microbiota, enhancing the integrity of the barrier function, and then also reducing gut inflammation overall. It also has the ability to aid in many digestive issues like bloating, and then it also will support nutrient absorption. So like I said, it's a little bit newer to my knowledge, but there's some really good clinicals supporting the use of Klepios. And then a really nice summary slide for you again, depicting the complementary roles of both, both probiotics and prebiotics. And again, this is going to be to improve the intestinal microbiota homeostasis overall, and then maintain that gut barrier function, and also modulate indirectly these immune responses. Okay, so postbiotics. So postbiotics are really beginning to emerge more often in the market. They offer, a few advantages, such as stability and no viability concerns, right? Because they are pasteurized, we don't have to worry about tracking them to make sure they're alive at the right location of the gut or the intestine to confer a benefit on the host. So this also makes them very simple to store. They don't necessarily have to be in the fridge, and they're unaffected by the use of antibiotics as well. They have quite a high safety profile because of all of these things I just mentioned, with no risk of microbial translocation. So they're suitable for immune-compromised patients or other vulnerable populations. Elderly might be somewhat another population to consider for postbiotics. Pasteurized Akkermansia Muciniphila. This is unique to Metagenics. It's a postbiotic form of Akkermansia. It's been clinically studied to promote desirable metabolic function in humans, essentially. And it does this via an outer membrane protein, the AMUC 1100. AMUC 1100 has the ability to bind to toll-like receptor 2. This is going to regulate tight junction proteins. Those are found between intestinal cells. But it also has the ability to downregulate pro-inflammatory cytokines, and it does this systemically. Okay, so a few slides looking at supporting nutrients. The first one we're going to look at is glutamine. This is widely used for gut health protocols by integrative doctors, and that's because it has an essential role in maintaining and repairing the intestinal lining. It's the primary fuel source for enterocytes. Those are the cells that line the gastrointestinal tract. It will also support the integrity of the gut barrier, And glutamine helps maintain that healthy and functional intestinal lining. And we need this healthy functional lining because it's crucial to keep the bad guys out and let all the good stuff through the right away, the passage. So we can prevent, this intestinal permeability with the use of glutamine. And then ultimately, we're going to be able to affect various other organ systems as well, right? We don't have that systemic inflammation happening. The recommended dose, as you can see here, it varies. It depends on the state of the gut. You can also see that supplementing on the lower end of the range, like 15 to 20, I'd say, like grams per day, is going to still yield impressive results for patients that have compromised gut function. And that's over an 8-week period of time. Zinc carnosine, this is commonly used for its ability to promote the healing and integrity of the GI lining. This form of zinc, the complex together, is very unique, and that's because it adheres to the stomach and the intestinal mucosa. So because it can adhere there, it's going to provide this targeted protection and repair. So over time, zinc carnosine is going to help reduce inflammation. It can support epithelial cell regeneration. It has some antioxidant properties as well, but ultimately it's just protecting and soothing this gut lining. The ingredient is often a game changer, especially at reducing symptoms for conditions like gastritis or acid reflux. I have a lot of good results in patients when they take the recommended dose, 75 milligrams twice a day, at breakfast time, so just before they eat, and then again before bed. Not too often have I had to increase that dose. Okay, so berberine. So before berberine's metabolic health buzz, it was often used in gut health protocols, and it's used often that way. And that's because it has a lot of antimicrobial, anti-inflammatory, and a lot of just gut regulating properties. It can help balance the microbiome in the gut. It can target pathogenic bacteria, fungi, parasites. All the while, it's supporting the beneficial bacteria. It will not kill those off. So berberine can reduce gut inflammation, enhance intestinal barrier integrity. It makes it really an effective therapy when addressing conditions like SIBO or dysbiosis. And if you think about this information, but then also mechanistic slides that we went through at the beginning of the presentation, it should help explain why berberine impacts blood sugar dysregulation as well, right? Spoiler alert, is all coming from supporting the interactions with the gut. So support the gut, happy gut, healthy gut, and the rest of the body kind of mirrors that health. Aromatic essential oils. So this could be thyme, oregano, lemon balm, sage. They're all potent antimicrobials, anti-inflammatories. Digestive supporting properties associated with all of them. They date back centuries. So tons of clinical use, anecdotal and human clinical trials supporting their use. They help balance gut microbiota by inhibiting, again, pathogenic bacteria, yeast, fungi, parasites, but they spare the beneficial gut bacteria. Thyme and oregano in particular are effective at addressing microbial overgrowth. Lemon balm and sage, they're more soothing. They're going to soothe gut inflammation and support digestion. And I think it's also important to note that these botanicals also have carminative effects, right? So they're able to reduce bloating and gas while promoting overall digestive comfort. So for me, when you see a formula or ingredients like these in a formula that have multiple actions, they're kind of at the top of my list to use in the toolkit because it makes them very valuable in supporting multiple clinical outcomes at once. Specialized pro-resolving mediators, these are a group of molecules that help the body actively move from this protective inflammatory response that might be fighting infection or responding to an injury into this healing inflammatory process. So specialized pro-resolving mediators, they're natural compounds. They're produced from omega-3 fatty acids, and they do help clear away immune cells that are no longer needed, essentially. They are going to help repair tissue and restore balance in the body overall. So they're responsible really for just resolving or like switching off inflammation in order to prevent this chronic vicious circle of inflammatory state. And over time, we know that these chronic inflammatory states can manifest as pain, tissue damage, or autoimmunity. So to have, these natural compounds to be able to regulate that process in the body is quite profound. Okay, so this is just, this figure is just looking at the role of specialized pro-resolving mediators in managing that inflammatory response. So it shows how inflammation naturally peaks during the initiation phase. That's the red graph, part of the graph, before SPMs are going to be introduced and then actively resolve it, which is shown in blue. And they'll do that by enhancing immune cell cleanup, reducing inflammatory signals, and then again, just promoting that tissue repair or back to homeostasis overall. This slide is interesting, really, because if we extrapolate the research, it gives us some really good insight into clinicals and prevention medicine, essentially. So this is comparing two types of macrophages. They're both involved in the inflammatory process. You have on the left-hand side pro-inflammatory M1 macrophages, and then on the right-hand side pro-resolving or M2 macrophages. And a lot of the research that has recently been published has shown that being able to shift the body from M1 to M2 macrophage influence could really, help the body overall respond to triggers, essentially, that are threats to the body. So again, it's not surprising that if we, change dietary habits or direct supplementation with SPMs, lifestyle interventions to promote stress reduction, all of these great things that as integrative docs, we constantly preach. If we can do this, we're able to shift the M1 macrophage to the M2 macrophages and be able to influence essentially how they respond. So, in other words, if the immune system is going to be programmed a certain way when it comes in contact with a trigger, it's going to be ready to respond with M2 versus react with M1s right away. So the goal is to ultimately modify as many obstacles to cure as you can and get to that M2 environment. Okay, so this kind of concludes the theory and science in the presentation. I think that I have a little bit of time left. So I want to use the last few minutes I have just to review a really simple case report. This is a 42-year-old female. She presents with a 6-week history of persistent epigastric pain. She describes the pain as burning. It's localized in the upper abdomen, the epigastric region. So eating doesn't seem to influence the pain, though, she's taken an antacid and that helps relieve it temporarily. In addition to the abdominal pain, she's going to experience frequent bloating. She's feeling full after eating only small amounts of food. She experiences occasional nausea, which is more prominent after large meals, but denies vomiting. And then over the past month, she has not been able to eat as much as she usually can. So she has a decreased appetite. It's really just because she's in pain and discomfort. And she actually lost, I think it was around 7 to 10 pounds. I wrote 7, but it was around, we'll say for purposes, 10 pounds, just from pain and discomfort associated with eating. The patient also reports intermittent episodes of heartburn. That's usually after she has coffee or alcohol or spicy foods. She denies any recent changes in bowel habits, but she mentions that she did have a couple bowel movements that were dark, tarry stools that happened within the last 2 weeks, and she never experienced that before. Her energy levels have been lower than usual, and she feels fatigued throughout the day. She attributes this partly to the discomfort from her symptoms, but also to work-related stress, because that's been high for the past few months for her. So I felt it was important to note that, in her diet, it was mostly processed foods, irregular meal times. She had minimal fruit, vegetable consumption. She drank quite a bit of coffee daily, so 3 to 4 cups of coffee per day, 2 glasses of wine per night, occasionally more if she had social events associated with work. She has a 22-pack-year smoking history, tobacco only, but she did quit 3 years prior to the appointment. And again, just high stress, like work pressure, family, financial concerns. Her mind's always going. She's always thinking about a lot of stressors in her life. Okay, so just additional pertinent history. So she was diagnosed with gastritis 4 years prior. It was managed with dietary changes and antacids with no recurrence of symptoms until recently. Meds, she occasionally uses ibuprofen for headaches and menstrual cramps, especially when stress is high. She mentions that her headaches, like there's more pain associated with her headaches, and when she has high stress at work. She often exceeds the recommended doses during these time periods as well. Family history, is supporting this gastric ulcer, GERD, hypertension picture on both sides, maternal and paternal. So on physical exam, so I noted she had slightly pale conjunctiva. She had pain in her epigastric region during palpation. It was pain, but also it was uncomfortable. I could feel some gas bubbles as well during palpation. But then also she had these positive Chapman reflex points at her stomach and also at the gallbladder point, which is no surprise to me. But again, it just kind of helps solidify what I'm thinking, what's going on with her. Okay, so initial recommendations. So I did order serum labs. They all were within normal limits. I did not order comprehensive stool or GI testing for this patient at this time. And frankly, that was just because I was quite confident I was working with repercussions of her gastritis, peptic ulcers, or peptic ulcer disease that might have started to bleed for her. So recommendations were surrounding diet, supplements, stress management. I did refer out to a chiro colleague of mine for soft tissue work. When I just palpated her musculature, especially on the back, it was tender to touch. There were multiple trigger points, and the spinal segments that correspond to those areas had a lot to do with her presenting symptoms. They coincided with her presenting symptoms. Okay, so diet-wise, I asked her to eliminate aggravating food, so spicy food, coffee, alcohol. I want her to incorporate more alkaline and anti-inflammatory foods. Much of this conversation was coaching this patient to be successful, really, though, in preparing easy meals at home. I think it was mostly a huge shift for her because she eats out a lot. It was processed foods and it was really irregular. So we wanted her to have balanced meals, eat at specific times of the day. We wanted her to cook at home. And so we talked a lot about the use of a crock pot, maybe food prep on the weekends, just different things that would ultimately make her successful. She needed, again, to remove coffee because that was definitely an aggravating symptom for her. And we wanted to increase daily her water intake. Supplementation-wise, I used a formula with glutamine, aloe leaf extract, deglycerized licorice, and that was to soothe the inflammation and support her mucosal tissue. Multi-strain probiotic was chosen, and that was to rebalance and replenish gut microflora. Zinc carnosine, this was key for her, especially for mucosal repair and healing of any ulcers that were present. And then lastly, I suggested vitamin C, and that was to enhance, the immune function, aid in the tissue repair. I thought, it could be pretty beneficial as well for her adrenals, given the high stress in her life. Okay, so it was important for me that, it didn't matter what this gal incorporated per se. I just wanted her to start thinking about incorporating some kind of stress management techniques into her daily regimen. These were only suggestions that I had given her. But again, I was open to anything that would really just bring her joy and get her away from work and stressors in her life. So she actually committed to begin painting, as this was something she really enjoyed doing when she was in college. So at the 2-week follow-up mark, she noted reduction in epigastric pain and nausea. There was some bloating that persisted. At the 6-week follow-up mark, epigastric pain resolved, significant improvement in bloating, and her appetite had increased as well. So all good things. And so really, like, this case is just, it's just a great example of how simple interventions, very simple interventions, to address disease process can really just shift pathophysiology very quickly. So to summarize, the info that was covered today, a lot of it, I think, again, it was review. A lot of the pathophysiology might have been a review for you, but I think that what we hope you walk away from today is that you have a different appreciation for that GI super system, all the various axes that stem from the gut and the systemic repercussions when that balance or that eubiotic microbiota becomes dysbiotic. And really thinking about, again, back to basics, how can we support the gut, but then also support systemically what might be taking place. Okay, I think that's it. In the nick of time, Amy. I can't hear you though.
That's a classic one, isn't it?
Yeah.
Thank you.
Yeah.
Thank you so much for this presentation, Malisa. Lovely to have everybody on the call today. We have just enough time for some Q&A. So anyone with Q&A, please pop them in last minute here. Let's see. One of the questions that we wanted to ask was, have you had much luck giving patients butyrate to assist in healing the gut?
That's a good one. So I don't really use single ingredient formulas much anymore. I did dabble in butyrate a couple of years ago, but there's quite a bit of research supporting like the theory that a lot of these short-chain fatty acids, butyrate is a short-chain fatty acid, that they need to be in a specific ratio to really go on and do what they need to do, like downstream. So I think that there's definitely people on this call, I'm not going to argue with it, they're getting success for sure, but there has to come a time where more than just butyrate is needed to get success because of the ratio, but then also there's just more metabolites that exist in addition to butyrate. Yeah.
Excellent. And another question that we have is, how effective are dietary prebiotics in rebalancing the gut microbiome versus taking a supplement? I'm asking because of patients who are intolerant of prebiotics, such as inulin.
Yeah, so I think that it's always best to be able to like do dietary modifications, right? Like eating real food is always best. Supplements are exactly that. They're to supplement what we can't get from the diet, right? In instances where there are sensitivities at that point, for sure, you could use supplementation. You might not need to use prebiotics right off the bat either until you can promote that diversity and microbiome health overall. So I think either or, I would say choose food first if you can, and then supplement what you can't eat. Mm-hmm.
Excellent. Well, sort of as we wrap up here, what are some overall thoughts that you can leave us with, Malisa, just to kind of send us off here?
Okay, I think that we all love to treat the gut. We usually start with the hole in the middle. Again, I think that the takeaway is that let's think about like some basic therapeutics that not only hit the gut, but then also systemically, what is the impact of the dysbiosis, and see what we can do there. Because there's a connection, right? Everything's connected, the whole body experience. Yeah.
Excellent. Well, thank you everybody for spending some time with us today and joining this presentation. Everyone take a look out in their emails early next week for a link to view this recording, and then also a special offer from Metagenics. And I just want to say thank you again so much to Lisa and to everyone who joined. So have a great afternoon.
Thanks, Amy.
Thanks, everyone.